Welcome to the She Found Motherhood podcast. Today we have Noelle from Nourished Beginnings. I'm so excited to talk with her about how to help manage through food our common first trimester symptoms like nausea, constipation, and heartburn. There are so many tips and tricks we can add on that we can help improve these symptoms. So Noelle certainly goes into more of the dietary methods and the lifestyle changes that we can do to address these symptoms. We're really excited at the end to talk about her upcoming course, how to have a nourished pregnancy. She's going to chat in detail, but essentially it is everything you need to know from a dietary point of view on how to prepare for pregnancy, stay healthy throughout the pregnancy, and really make sure you're getting your nourishment during that postpartum or fourth trimester. Noelle is offering our She Found Motherhood listeners a 20% off her course. So the code for that is SFH20. You can find the link to her course on our resources page at our shefoundhealth.ca website. Welcome to the She Found Motherhood podcast, where our goal is to support you in the journey from pregnancy through to parenthood. We are so passionate about this time in a woman's life, and we want to make sure you have fun and reliable information you can trust. She Found Motherhood podcast is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This does not apply to every situation. If you have questions or if you have received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Welcome, Noelle. Thank you so much for joining us today. We are really excited to talk about some of the most common symptoms that women in the first trimester face and how we can use food as medicine to help manage that and just to how to get through that kind of first trimester. So Noelle, why don't you start just by reminding us about who you are and what you do and what brought you to this point in your kind of your passion and your career?
Absolutely. Thank you so much for having me. It's wonderful to be back on your podcast. My name is Noelle Martin. I'm a dietitian I live in Ontario, but I'm licensed to practice in Ontario and British Columbia. And I have a passion to work with moms to be, those hoping to become pregnant, because I have been where they are. I experienced infertility as I was going through pregnancy. I was floored with the intensity of nausea, constipation, reflux. It's really not talked about that much. And I couldn't find resources. And I know there's way more now than there were when I was pregnant almost 10 years ago. But the reality is that I think, information and having knowledge and having resources available, that's so empowering for women. And to know that they aren't alone, number one, that this is very normal. And that there definitely are things that can be done to help to reduce some of these challenges. And sometimes the smallest change can bring the biggest outcome. And I remember I had a friend who said to me, try green apples. And I thought, green apples, really? And then I would have green apples and I wouldn't feel quite as nauseous. And I thought, this is amazing, this small thing. So just small details. So that's what my hope is that when I work with women who are heading into pregnancy and in their first trimester of pregnancy, that I can really help them feel empowered to try small things that can bring big changes, but also just know what they're experiencing is normal. And sometimes we have to just do less and have grace with ourselves. That is a piece of it as well. I'm also very passionate about working with moms, talking about what we call the fourth trimester. And I know we won't talk about that a lot today, but we can another time. We have to remember that all this attention is on the new baby. And we need to make sure there's enough attention and nourishment and hydration and rest for the new mom too. So there's first trimester challenges and there's fourth trimester challenges that both I'm quite passionate about working with moms on.
Awesome. And our last podcast we did together, we did kind of about the preparing for pregnancy. So a bit of around gut health and healthy gut and how to choose a prenatal. And so if you haven't listened to that podcast, make sure to go back and check that one out if you're in the preparing or early pregnancy realm as well, because lots of great tips and tricks there. So why don't we get into it? How about we start with nausea? This is the one that most people have some suffering. I thankfully never did. I had one half day of nausea just because my friend who was also working in the same office was super nauseous. And so I think it was like sympathy nausea.
Yes.
But other than that, I didn't. So, but certainly a lot of the people we care for in early pregnancy do really suffer from kind of nausea, plus or minus some vomiting. So why don't we start with that one?
Absolutely. So a couple of things to remember is, we've traditionally called it morning sickness, but when I work with the class that I work with at the university, I always say this is anytime sickness. This is anytime nausea, right? It's important for us as practitioners to know that, as you know. My personal experience was I was pregnant with twins and feeling fine. And one night my husband had brought home pad thai takeout. I thought, oh, this is great. Didn't have to make dinner tonight. I'm feeling tired. And I started eating and this wave of nausea came over me. And I thought either this pad thai is bad or this nausea thing is not just morning sickness. And sure enough, it was a nausea that continued all the way through to when those babies were born. They were born at 29 weeks. And I did eventually go on diclectin at week 13 to help a little bit. But the reality is that I didn't stay on it long. I stayed on it like a week or two. I felt horrible on it. And I had to just go back to some of the measures that I had been trying. And I found that the natural, quote unquote, natural measures that I was trying, those worked better than the diclectin. It made me very tired. And I know it does for most people as well. So I want to say that anything that I'm mentioning today, one of these things may work, many of these things may work. Not to feel guilty if you end up having to take diclectin as part of it by any means, and knowing that tiredness is very natural that comes with it. But I wanted to dig into some of the other things that can be done. So one of the things that often isn't talked about is when you wake up in the morning, if you stand up out of bed very quickly, that can bring nausea on that's hard to come back from. So I usually recommend that people try to have something at their bedside that they can consume before getting up. So if you have a partner or someone that can bring you a little piece of toast, fine. If not, you could even leave like a granola bar. Something crunchy is sometimes great, like a cashew granola bar, or some crackers, just something where you've woken up, you're laying there and you eat something, so that your blood sugars can start to become balanced before you even stand up in the morning. That's a huge one. Another one to do with morning is if you are experiencing kind of more the morning side of morning sickness or something that's lasting all day long, having your prenatal later in the day, so either dinner time or even right before bed, can be very helpful, because if it's going to cause a stomach upset, then at least you're sleeping, or it's a time of day when you're not, having as large expectations for yourself. Can make a really big difference throughout the day. Trying to, similar to what we talked about first thing in the morning, trying to eat before you're hungry, basically, because sometimes hunger just turns into that feeling of nausea. And so I often ask my clients to put either a timer for 60, 75, or 90 minutes on their phone or on their computer, something to say, oh, it's time to eat and drink, before they get hungry. And sometimes we have to experiment a little bit. Do you need something every hour or something every hour and a half? Because once you become nauseous, it's harder to not be, right? We want to try to prevent it in the first place. If vomiting is part of this, hydrating very well through both the actual beverages, but also through hydrating foods can really make a difference. So like watermelon, muskmelon, cantaloupe, cucumbers, you won't necessarily feel like certain foods. It's very different. The idea of like appetite versus hunger. So our hunger is our physiological desire to eat, and our appetite is our psychological desire to eat. We find that the appetite is very kind of up and down and skewed. You might even feel like something, and then once it's in front of you, you don't want it, or you think you don't want something, but if someone makes it and puts it in front of you, you are willing to have it. And so just being ready for the fact that hunger and appetite don't work together the same during pregnancy, especially in that first trimester, and sometimes beyond that, as they would outside of the time when you're pregnant. And so knowing again that is normal. And when you do eat, thinking about textures that help you feel better as opposed to cause you to feel more nauseous. So for some, crunchy things is really helpful. For some, smooth is really helpful. That sense of smell is heightened during pregnancy. And so if we recognize the fact that smelling food while it's cooking could interrupt our desire to eat it, right? Or smelling a food that's a certain texture causes you to think about a texture that leads to nausea or vomiting for you. So just recognizing all of these things, knowing it's a short-term window, and setting yourself up for success. I know there was a lot of things I couldn't handle smelling them cook. So while the cooking was happening, I'd have to exit, or I knew by the time the meal came, I wasn't going to be able to eat. So I enlisted help. Sometimes we have to enlist help, and it's great practice because once the baby comes, you have to be ready to ask for some help, right? A little bit harder right now with all of COVID, but as much as possible, we want to try to ask for help. And then my last piece for that would be things like sour foods, ginger, there's peppermint, there's certain things that you can have that would just naturally help in terms of kind of that nauseous feeling that can come with foods. So in terms of sour foods, adding lemon or lime or grapefruit right to your water can sometimes help, and just sipping on that throughout the day. Green grapes, green apple, as I mentioned earlier. For some women, it really helps. There's actually sour candies that have been marketed to help in terms of pregnancy nausea, when in reality, we could just have a great apple.
True.
So those are my top tips.
Yeah, and those are great. And I want to kind of chat about a couple of those a little bit more from kind of my perspective. And Sarah and I certainly did a podcast around nausea and vomiting in for our first trimester, and really didn't delve into the more dietary stuff. A little bit we did. So I really think that's great that you've mentioned those. A few of the things that we mentioned for the prenatal vitamins. So you don't need to, if the prenatal vitamin is making you nauseous, then just take a kid's chewable vitamin and a folic acid. Totally fine. If you've kind of done some preparation for pregnancy and eaten healthy leading up to it, your baby they're like the ultimate parasite, right? They'll suck everything they need out of you. So that is fine. If the prenatal vitamin makes you nauseous, then just at least a folic acid. And if nothing else, then that's great. Yeah. And we talk a little bit about that in our other podcast that we did together.
There's also a new, are you okay with me talking about brands on here?
Sure. Go for it.
I'm careful, like not to be too specific about brands, but I'm really excited. There's a new, technically marketed to kids, iron supplement. They have
I saw that on your reels.
Yeah, they're out of Vancouver. It's a mom out of Vancouver. And it's so amazing because it tastes good. You can do chewable, liquid, or drops. But if you do the chewable or liquid, they taste good. And it's so easy on the stomach. It's not leading to the negative outcome we sometimes see. So I think this could be a game changer for some women in first trimester, to be honest, and even throughout all of pregnancy.
We'll put that up on our resources page on our website. Yeah. So I'll get the info from you and we'll make sure we put it up. So that's where we have all of our stuff that we recommend that we think is great, courses and other products. So we'll put that up on our website. That's great. I'm excited to hear about that because you're right. Iron is a challenge. And so most pregnant people go on iron at around 25 to 28 weeks. But it can cause quite a bit of nausea.
Yeah, it can.
Yeah. So that is wonderful. So the next thing, we were kind of talking about nausea. And one thing some people don't realize is that reflux, so heartburn, can also trigger nausea. So oftentimes we have to think about both of those together and sometimes treat both of them to get optimal success. So why don't we talk a little bit about reflux or heartburn in pregnancy and how we can use food to kind of help manage that?
Absolutely. So bit of explanation to it when we talk about this idea of heartburn, right? The reason it burns is because we actually have a coating in our stomach that can handle this acidic environment. But that coating is not in our esophagus. And so if the acidity, right, in our stomach now is being experienced in the esophagus, it burns, it hurts. And the esophageal sphincter is actually just naturally is weakened in pregnancy. And that's the trap door that things are supposed to go esophagus to stomach, but sometimes can come back up when that is weak, right? And that's because of hormone base that changes in pregnancy. And so what we know is it's more likely to happen, especially as time goes on, because now we have this being inside of us causing more pressure. So there's a few things that we can do from a dietary perspective. One of them is eating several small meals and snacks during the day. And as you've just said, this helps with the nausea too. So it's a dual effort. And I often say, choose a food that you maybe feel like you can handle, that you're craving. Let's use toast for an example. It's the most common. How can you add just a little bit extra nourishment to that? Can we put some nut butter and hemp hearts on there? Can we put some avocado and chia seeds on there? Do you feel like a little bit of tuna salad or a sliced egg? Like, what can you do to take that toast and just take it next level? So eating every 60 to 90 minutes throughout the day can help reduce reflux and can help reduce nausea at the same time. And the reason is the stomach never gets super full. And so there's less likely of that kind of push up. If you think about when you cook a turkey or a roast or a chicken or something, if you take the juice and you put it into the refrigerator, the fat rises. The same thing happens in our stomach. That fat is kind of the last to be kind of digested through. And so when I think about reflux and I think about a really high fat meal, I think about kind of the fact that that can push and increase the chance of reflux. So we need healthy fats in the diet 100%. I just say, again, spread it out during the day. Moderation is huge when it comes to reducing reflux. Having a little bit of elevation under the head. So whether that's putting like a brick under the head of the bed or some extra pillows can sometimes be helpful. Trying to stop eating a little extra time before laying down can be helpful. This is one where it kind of goes against the idea of reducing of nausea, because we want to see eating every once in a while. So then we say, okay, well, what's bothering you more right now? How do we want to, kind of combat that? And then beyond that, in terms of dietary, it's very person specific, because there are certain foods that do tend to cause reaction more than others. Some normal not normal, more common ones would be things like garlic, onion, spice, curry, peppers, cucumber. But some people say, I can eat peppers and cucumber, no problem. And it's something else that causes them. So noting when the reflux is worse, but also not driving yourself crazy and knowing that for some, you could have a piece of toast and have some reflux just because your esophageal sphincter is weak.
For
and
sure.
You got a baby in there.
I know, it's true. The progesterone, which is that hormone that helps us progestate in the beginning, is quite high, and that loosens all of our sphincters, all of the ones all over the place. So very common. Now, the other thing I wanted to talk about quickly is kind of blood sugar levels. And a lot of us in the first trimester, to kind of combat that nauseous feeling, crave carbs. But carbs, you get these big spikes in your blood sugars, right? Which then give you hunger, which then make the nausea worse. So adding on, and you kind of alluded to it, adding on a protein or a fat onto that can be helpful for that kind of satiation and like just leveling out your blood sugars. Is that correct?
That's exactly right. And even though it's funny, we have a course coming up, which I know we're going to talk about a little bit, but we think about pregnancy in terms of trimesters, but the reality is that the way the body metabolizes nutrients is actually cut into just two sections, 0 to 20 weeks and 20 weeks until you give birth. And so that's something that I'm going to dive into a little bit more in that course, just to help women understand why the way that they eat, makes a difference in terms of how their body is going to feel basically during not just trimesters, but in kind of two halves of pregnancy. And throughout all pregnancy, we see benefit in any time that we do have a source of carbohydrate, which we need. We absolutely need it for both mom and baby. Carbs are a beautiful thing. But if we can add a protein to that and or a fat, it really does help, yes, in terms of balancing blood sugar. And then also both protein and fat are things that we need as well. And the more understanding that we have, I think that the easier it is to then put the ideas into action, as opposed to being like, well, what does it matter if I just have a piece of toast? If that's all you can handle, fine. But if we can next level it, then let's do it.
That's so interesting. I have no idea about that, splitting it up into two segments and how our body, I'm so excited to take your course. Can I just say that? We'll talk about it later, but I'm like, in doing this, Sarah and I have both learned, Dr. Sarah and I, there is so much out there that we as physicians have no idea about. And we all have our area of expertise. And I've done a few podcasts with yourself and with a couple of the other dietitians, and just like going through your Instagram accounts, I have learned so much. So I'm just going to say, I am so excited to be taking your course when it comes out in January. So, but we will talk about that later. Okay. So we've kind of gone over nausea. We've kind of talked about reflux and some tips and tricks around that. And so now is the most common symptom in the world in first trimester and postpartum. This is a big one too.
Postpartum, yes.
it maybe not, it's a symptom, but it's a big fear as well. Postpartum, that
Totally.
postpartum first poop is everybody's kind of a big fear.
The big question.
After the pooping in labor fear,
Yes.
pooping in delivery, again, totally normal, means you're pushing in the right spot. Baby's head's got to make room. Totally normal, everybody. But the first postpartum poop is a big fear for a lot of people out there. So let's talk constipation.
Absolutely. Absolutely. So I think of it as like a trifecta to help in terms of anytime, right? Years down the road, this will still help. But as you've said, in the first trimester and the quote unquote fourth trimester, these are big deals. So a couple things. One, everyone expects me to say it, so I'll say it first, fiber, but that's not the end of the story, because adding more fiber into your diet isn't the be all and end all of helping with constipation, but we need it there. So looking at fiber from a variety of sources, there's two types of fiber. There's soluble and there's insoluble. And almost every food that contains fiber has a combination of. So if we look at an apple, for example, the insoluble fiber is in the skin and the soluble fiber is on the inside. If we look at grains, we see that like wheat bran is more insoluble fiber. Oats would be more soluble fiber. They soak up the liquid a little more readily. So we want to add both because the combination of both is what helps the stool move through our bodies. But in the same way that if you had a dry sponge that you were trying to push through a pipe, you wouldn't get very far. We need to add water. So the more fiber we have, the more water that we need. And that creates this like perfect balance, right? In order to get that sponge through the pipe, we've wet it, it goes in easier. But what's interesting is that if we can add body movement, when we move our skeletal muscles, our involuntary muscles on the inside of us, that paralysis happens just a little bit, or peristalsis, sorry, happens just a little bit better. It happens a little bit better. And so what we see is that things can move through. So my trifecta is an adequate amount of fiber throughout the day. Notice the theme here: reduce nausea, eat throughout the day. Reduce reflux, eat throughout the day. Reduce constipation, eat throughout the day. Add an adequate amount of water to that throughout the day, and then try to move your body. And for some, it's very helpful, rather than saying, oh, I'm going to try to go for like an hour walk, going for a 15-minute walk a few times a day. Moving your body with yoga, with Pilates, of course, within the realm of safety with prenatal, but doing anything that you are voluntarily moving your body, you're more likely to see things moving through you. And I find that a lot of people do try to cut out coffee in first trimester, or just don't feel like it anymore. And you can have caffeine. There's your coffee. You can have caffeine in first trimester. We just want to remember all the sources that caffeine comes from, and we want to keep it within, limits. But still, we have moms who, taste buds change, right? They don't feel like it, or they just have chosen not to. And for some, that morning coffee is what gets things moving. Right. And so we have to remember that sometimes we have to overcompensate in some of these other areas as well. But I do encourage you that if you're fearful of caffeine, you certainly can have a little bit, and it's fine. Right?
Yeah. And we've certainly talked about that and promoted that a lot, right?
Yeah.
1 or 2 cups of coffee is totally fine. And if you want to do a half calf, regular calf, that's totally fine too. Yeah. And in terms of hydration, because a lot of people say, you know what, I'm super nauseous. I can't, every time I drink, I get nauseous and I vomit. So we know that if you are able to take small sips throughout the day, you should be able to adequately hydrate yourself. So don't take a glass and chug the entire glass of water at once. You're going to feel crummy. But if you can have a sip every 5 or 10 minutes, then you should be able to adequately hydrate, fill up that sponge, so to speak, and keep you and your baby healthy. So that's a good tip. And adding that lemon or some kind of like something that kind of flavors it, whatever that is, strawberry, I don't know, but certainly some people are put off by regular water. So flavoring it in a healthy way is totally doable and manageable. And then just have a water bottle with you with a straw or something that you can sip frequently throughout the day. And you should be able to maintain your hydration and then get your bowels a little bit more softer.
Exactly. Sometimes, the little cups that come with like children's Advil or Tylenol or whatever, sometimes those feel less daunting. So having a little cup that you like little, really small, right? That you have little bits every few minutes.
Noelle and I are on video right now, and I'm laughing at her because she looks like a giant eating a little cup. It's like convincing my children to eat broccoli. You're like a giant and you're eating a tree. Anyway, sorry. Sidebar, everybody. You gotta have fun with it, right?
That's right.
Yeah, so that's some great tips. So in terms of that fiber,
Mm-hmm.
give us some concrete recommendations on
Sure.
getting that in.
Okay. If texture isn't an issue, oatmeal's great, right? Because you can have it as overnight oats. You can do it in the slow cooker ahead of time and pull little bits out. You can make it morning of in the pot or in the microwave. Like there's lots of ways that you can incorporate oats. If texture is an issue, then making something like a baked oatmeal, that's I have a couple baked oatmeals that I have as part of the course's recipes that I'm going to release, because sometimes just that texture of oatmeal doesn't work. It doesn't help in terms of nausea. So oats are great. Barley is also great if we want to move away from, if we have someone who maybe can't have oats, right? Barley is great. Fruits and vegetables, basically the spectrum of fruits and vegetables that you can handle without feeling like your nausea or your reflux is increasing. So if you can't handle them as they are because of texture, putting them into a smoothie, for example, is great, whether it's kale or spinach, or I have a smoothie here right now that has cauliflower rice in it. Like you can put just about any, you get frozen cauliflower rice in a smoothie. It's great. So any fruit or vegetable that you can eat in any way, raw, steamed, roasted, in a smoothie, getting that fiber in, it counts. Smoothies are very different than juicing. If you juice, you can get some nutrition from it, but you're not getting the fiber. That's the one thing we don't see through. So we want to put that whole, vegetable in there. And I would
can we
encourage,
just talk about juice for a second?
Yeah.
Juice is not great in pregnancy because
No,
it's a lot of useless calories. So it's a lot of kind of the sugars from the fruits and veggies, fruits especially, and you
yeah,
don't get that
the
balance of
fiber.
fiber, which is so important. And so, if you're super constipated and you want to have some apple juice just to unconstipate you, sure, once in a while, but try other measures first. More of a
Yeah,
preventative would be like changing your diet. But if you're like totally bunged up and you need some help, then apple juice might be okay for a little bit, but let's not use that regularly. But smoothies, great, because you're still getting all that fiber and that good stuff. You can throw some tofu in there and get your iron,
absolutely.
or your protein. But yeah, let's avoid juices.
Yeah. And if we do have a situation where someone, like you're saying, they're just going to have like a little bit, buying just like a tetra of juice boxes then doesn't create the need to like feel like, well, I opened the bottle or I opened the jar, so I have to finish it. Right. Juice really doesn't bring us much. It's not a necessity in life. And I do prefer to recommend eating our food over even drinking it in a smoothie, but certainly smoothies are a great way to sometimes just, throw some extra things in that you're not stomaching well. And then soups and stews are great as well. You can add lots of vegetables in there. So ideally, every time that you eat, thinking about either a grain or a fruit or a vegetable that has fiber in it. And if you're adding fiber every time you eat, there's a higher likelihood of you getting to the goal of what your body needs. And we do certainly have recommendations under the DRIs, right? Which is all our recommendations for all our nutrients in terms of how much fiber you need. But I'm a big proponent of individualizing nutrition. And what's an adequate amount for someone else might actually cause loose stool in another person. And so we want to really look at if you have well-formed stools and you don't feel constipated, then that's the amount that you need. And we want to keep up with that.
Yeah. And so constipation is one of those things, it's symptom management, right? So if you're not symptomatic from it, who cares?
Yeah.
Or if you are a symptom, then let's make some changes.
Yes.
And certainly, so if people are working with their diet and they're doing everything they can, and they need extra fiber, do you recommend any supplements? So I know there's like Metamucil and Benefiber, like, do you have anything that you would recommend on top of that? And I appreciate you don't like brand names, but
yeah, no. Well, first I usually recommend adding psyllium husk to their favorite muffins or cookies or brownies or oatmeal or anything like that, because it's basically the same thing as Metamucil. And so instead of just buying it under a brand name with a flavor to it, you can just add psyllium to something you already enjoy. You can add a little bit of it even just to yogurt, and then you set it aside for a few minutes and then come back to it. And what you'll see is that the psyllium actually takes in the moisture of the yogurt, so it becomes almost like pudding, like in a thicker pudding texture. If you leave it for too long, it becomes rock hard. Like, you know that the psyllium really does work. But with more psyllium, it's a soluble fiber. You absolutely need more water. So as soon as you're adding, I would recommend a little bit. So for some, we start with just like a teaspoon and maybe get as much as a tablespoon in if we're doing like the yogurt thing, and then add a fair bit of water to the day. Or you're adding anywhere from a quarter cup to a half a cup to your favorite like baked good recipe. So that's the first place I would go. And then also ground flaxseed, because it has omega-3 in there, not the type that can easily convert to DHA that we're looking for, but certainly all omega-3 has its positives. So you've got omega-3 and soluble fiber when you look at ground flaxseed. Really important to remember that once we've ground flaxseed down, we have to keep it in the fridge or the freezer if we're not using it right away. We don't want to just stash it away in the cupboard. So,
why not?
Because of the amount of omega-3 in there, it can actually go rancid the oxidation can occur quite readily. Yeah. So it's 3 weeks in the fridge and up to 3 months in the freezer. But if you have some in your cupboard, I would encourage you to replace it.
See, I always learn so much. Okay, that's great. So some easy suggestions to add in extra if you can't get it from your diet alone. Brilliant. Love it. Yeah. Okay. Anything else in terms of those three anything else that we wanted to talk about?
I think like not from a food perspective, but just from like woman to woman, give yourself grace, right? Like when you have a cold, like you have a cold virus, you have the flu, like there are things that you can do to try to feel better, but you're aware like, okay, but I have the flu right now. Like I'm probably just going to be tired for a little bit. And I encourage, new moms, call them a mom the minute they conceive. These new moms, the baby hasn't been born yet. The baby's inside of you. You're a mom. To remember to give yourself grace, right? If you are extra busy, what can you cut out? What can you delegate? What can you pass over? Because it's been my experience too, that the more stress that's there, the higher likelihood that you're going to feel frustrated with the nausea, with the reflux, with the constipation.
Totally. The more tired you are, the more stressed you are, all of your symptoms are going to feel worse. 100%.
Yeah.
Okay. So Noelle, you are brilliant. I love talking to you and I love learning from you. So you have this course coming out in January, I do believe. Yes. Yeah. Tell us about this course, because as I've already said, I'm so excited to take it. But tell our listeners, what is this all about?
Okay, so my dream was to come up with a course that women could take either before becoming pregnant or near the beginning, and have all of the information that they would need for throughout pregnancy to the 4th trimester. And I know that doesn't mean that it's super niche down, but it is, because it matters. We need access to this information. And so basically over the course of 4 weeks, you have the opportunity to learn everything from what we've talked about today in terms of managing these nutrition challenges during pregnancy, and expanding upon some of the things we've talked about today with some more concrete resources. The key nutrients for a healthy pregnancy. There's only so much that can be communicated in an Instagram post, right? So it's more of like a tell me more. Like, okay, you've told me where I can find choline and why it's important, but tell me more. Help me put this into daily practice. And we're going to walk through what we call our macronutrients, so carbohydrates, proteins, and fats, and the micronutrients, and how the body reacts, sometimes the same no matter where you are in pregnancy, or how there's a difference for some of these in terms of whether you're in 1st, 2nd, or 3rd trimester, or whether you're in 0 to 20 weeks versus 20 weeks and beyond. It just depends which one we kind of look at. We're going to get into the background of that. When is the body in more of like what we call a catabolic stage versus an anabolic stage? And then we're going to talk a little bit beyond nutrition. We're going to talk food safety, nourishing yourself before, during, and after activity while you're pregnant. We're going to talk a little bit about mental health during pregnancy and heading into postpartum. Specialized diets. What if you've been a vegetarian or vegan? Can you continue to do that? What about gluten-free? What about dairy-free? What about if suddenly foods are bothering you that weren't before? What does that look like? And then we're going to talk a little bit about the 4th trimester. How can you prepare for it? Whether you're breastfeeding or whether you're formula feeding, how can you prepare to take care of you really, really well? And then we also have a bonus that it will be available just on its own, but we have a bonus kind of mini course that we're adding on for anyone who's interested on gestational diabetes. And so we have some very specific information for that like I say, it can just be registered for separately, but it'll be part of this. And then I'm going to do a live Q&A at the end. So a lot of it is recorded material sent over because I've asked our community over at Nourished Beginnings Pregnancy a few times, you know, do you like live? Do you like recorded? And time again, it's like 90%, if not 100% say, I want to take this in on my own time. Life is busy. And I get that. So everything is kind of pre-done, but then there's this live Q&A at the end for those who want kind of more of that touch point, right? That I can hopefully give answers to, you know, one person that helps all the people over and over again. So yeah, that's the plan. So that comes out in January 25th is when we start.
So presumably, can people have access to, how long do people have access to the recordings? Obviously the live,
Forever.
They can't go back. So forever. So
Forever.
Even if you're not pregnant now, or you're thinking about pregnancy, that would be a great opportunity. And then the other thing is, even if you're midway through your pregnancy, there's still probably going to be tons of learning that you can get it. And you can pull on it the next time if you have another pregnancy. So good.
Exactly. Yes. So once you have access in, you always have access to the resources. And if I choose over time, based on the questions that come in this first round, to add more information, you just keep getting that information that's added in.
Yeah. Great. Awesome. Yeah. So January 11th or 12th, we'll post it again. We'll post it on our resources page. We'll put up Noelle's course so you can easily find it. And then you are offering the She Found Health, She Found Motherhood folks a special deal.
Absolutely. You want to give 20% off to your community. We love your community. So we're going to go with the code SFH20. So SFH20 for 20% off.
So like She Found Health, SFH20. Great. Yes. So exciting. Thank you again for joining us. Always learn so much from you. And again, I am so excited to take this course. So anybody who wants to from our community, join me in it. And yeah, so great.
Awesome. Thank you for having me, Alicia. Lovely to see you today.
Always a pleasure.
If you enjoyed listening, please head over to iTunes, subscribe so you don't miss any new episodes, and please leave us a review. If you found this helpful, take a screenshot and share on social to help other mamas access this information.
Check out our website at www.shefoundhealth.ca and join our community. We send out weekly emails and release new content focused on this incredible time in your lives. We'll also be sharing exclusive offers, so be sure not to miss out.